Right now, somewhere inside your abdomen, there is fat that has never once jiggled. You can't grab it, you can't see it shift when you move, it doesn't respond to the light the way the soft layer under your skin does, it sits completely still, packed tight around your liver, your intestines, your pancreas, doing something your subcutaneous fat doesn't do. It talks, constantly. It sends out a stream of chemical signals that reach your brain, your blood vessels, your immune system, and your hormones, and when you start losing it, the first thing that changes isn't your waistline, it's the conversation. Most people lose visceral fat and have no idea it's happening. They step on a scale and see nothing, they look in the mirror and see nothing, and somewhere around day 4 or 5, when the cravings get a little quieter and the 3 p.m. energy crash doesn't hit quite as hard, they think they're imagining it. They're not. That's the biology arriving before the body does. Here's how it actually unfolds. In the first 24 hours of a meaningful caloric shift, whether that's reducing processed carbohydrates, eating in a time window, or simply cutting out the extra 1,000 calories that were hiding in plain sight, your insulin levels begin to drop. Not dramatically, not all at once, but the baseline starts to come down. And insulin, in plain terms, is the hormone that locks fat in place. When it's chronically elevated, which it is in most people who carry significant visceral fat, your fat cells get a signal to store. They don't get the release signal, they accumulate, so in those first 24 hours what you're really doing is flipping the switch from storage to release for the first time in a long time. Nothing shows on the scale, nothing shows in the mirror, but the switch flips. Days 2 and 3, something interesting happens with water. Visceral fat cells release glycogen as they begin to mobilize, and glycogen pulls water with it. This is why the scale sometimes drops fast in the first week and then seems to stall. You're losing water weight attached to stored carbohydrate, not fat tissue itself. Most people experience this as encouragement followed by confusion. The encouragement is real. So is the confusion. But the stall isn't failure. It's the body finishing one phase before the next one starts. By days 4 through 7, if insulin stays lower, something quieter begins. The fat cells that surround your organs, the ones doing all that talking, start to actually shrink. And as they shrink, they release less of a molecule called resistin. Resistin, in plain terms, promotes inflammation and tells your cells to ignore insulin's signals. It makes the whole system harder to manage. As its levels drop, cells start listening again. Your liver, which had been processing a steady input of inflammatory signals from the fat surrounding it, starts to get a break. Liver function improves. You may notice it as a general feeling of less heaviness after meals. A small thing. Easy to miss. Here's something most people never learn. Visceral fat also produces a molecule that actively suppresses a hormone called adiponectin. Adiponectin is one of your body's most powerful metabolic regulators. It increases fat burning, improves insulin sensitivity, and reduces inflammation in blood vessels. Visceral fat, while it's present and active, keeps adiponectin low. As visceral fat shrinks, adiponectin starts to recover. This process takes about 2 to 3 weeks to become meaningful, and when it does, you feel it before you can measure it. Cravings soften, the blood sugar swings that were driving afternoon crashes start to even out. You start making better food decisions not because of discipline, but because the biology underneath the decisions is stabilizing. This is the part that changes everything. The willpower you thought you needed, a significant portion of it was actually missing biology. The cravings weren't character flaws, they were downstream effects of a hormonal environment built by visceral fat. And as the fat retreats, so does the hormonal noise it was generating. Weeks 2 and 3 are when leptin enters the picture in a meaningful way. Leptin is produced by fat cells and is supposed to signal the brain when you've had enough to eat, but visceral fat, specifically the inflammation it generates, causes a condition called leptin resistance. Your brain stops hearing the signal even when leptin levels are adequate. It's like trying to hear someone in a room full of noise. As inflammation drops and visceral fat shrinks, the room gets quieter. Leptin signals start getting through. Appetite regulation becomes more intuitive. You feel full at appropriate times, sometimes for the first time in years. It doesn't announce itself, it just quietly arrives, and one day you realize you stopped eating before you meant to. None of this shows dramatically on a scale. Water fluctuations, muscle mass, digestive content, all of it masks the real change happening underneath. People who quit during weeks 2 and 3 quit right at the inflection point, right when the hormones are rebalancing and the deep biology is shifting. The mirror isn't lying to them, it's just slow. The inside is always first. By weeks 3 to 6, the changes in visceral fat mass start to become detectable. Not necessarily visible in the mirror yet, that depends on how much subcutaneous fat sits between the visceral layer and the surface, but detectable in how clothing fits through the midsection, how posture feels, how breathing feels during exertion. The abdomen, which is largely shaped by what's inside it, begins to sit differently. People often describe a sense of less internal pressure, less bloating, a kind of structural ease they couldn't have named before. Months 2 and 3 are where the cumulative hormonal reset becomes undeniable. C-reactive protein, a primary marker of systemic inflammation, shows meaningful declines in people who have lost even 5 to 10% of their visceral fat mass. Blood pressure starts to normalize, not because the heart got stronger, but because blood vessels are operating in a less inflammatory environment and regaining flexibility. Triglyceride levels drop. The liver, freed from its previous environment, starts processing fats more efficiently. And the whole metabolic conversation, the one visceral fat was driving with its constant inflammatory signaling, begins to sound different. Slower, quieter, more like a body that's managing itself rather than fighting itself. What you see in the mirror eventually catches up, but by the time it does, the deeper story has already been unfolding for weeks. The visible change is the last chapter of something that started in the dark, in the first hours of lower insulin, in the first days of cells starting to listen again. Visceral fat doesn't go loudly, it doesn't announce itself on a Tuesday morning with a dramatic before and after. It goes the same way it came, quietly, incrementally, in the space between the measurements. The body doing metabolic work doesn't look like anything from the outside. It looks like a normal day. It feels sometimes like very little. And then, over weeks, it feels like less noise, less resistance, a system that's finally getting out of its own way. The research is consistent on the behavioral inputs that move this process. Reduced ultra-processed food, improved sleep quality, consistent movement, and sustained lower insulin exposure. Not perfection. Consistency. The biology doesn't require a dramatic intervention, it requires a sustained signal that the environment has changed. Sleep matters more than most people realize. Deep sleep is when growth hormone peaks, and growth hormone is one of the primary drivers of visceral fat mobilization overnight. Poor sleep elevates cortisol the next morning, which signals the body to store, not release. The stack is interconnected. Every piece either amplifies or undermines the others. So if you're somewhere in that window, past the first week, before the mirror has caught up, and you're looking for evidence that anything is happening, the quieter cravings are evidence, the better sleep is evidence, the fact that your afternoon is slightly more manageable than it was a month ago is evidence. The fact that you're not white-knuckling your way through every meal is evidence. The body is doing exactly what it's supposed to do. It's just doing it where you can't see it yet. Trust the part that's invisible. It was always where the real work was happening.